Okay, so here we go. So most of you do know me. Hopefully, Yvonne, you can hear me as well. I don't know whether you've sound yet. So for those who don't, as I say, I'm Amanda from WPA, and I help people arrange their private healthcare policies and their cash plans and their business staff benefits. So a few facts about private healthcare in general. So at the moment in the UK, there are 6.9 million lives insured on private healthcare policies. The mix of that is 76% are business policies and 24% is personal policies, personal or family. And every single day, there's in excess of £10 million paid out in claims. So 365 days a year, that many claims paid out. So that's a lot of money. So let's see. So who are WPA? So as you know, you've probably heard me say plenty of times, we're a not-for-profit, been around since 1901, and I'm a franchisee of theirs. They have about 80 at the moment around the whole of the UK and Northern Ireland. So there's quite a few of us about. Obviously, no one as friendly as me in the Northwest. So yeah, happy to talk to anyone who's interested there. And why should you consider private healthcare? So as it says there, time away from your business with ill health is lost money. Increasingly, we can do lots of things remotely, but there are some things where you just can't. And if you are really, really ill, then if you're self-employed, it could be hitting you in the pocket. So what do we have? Got a range of policies. I work with 9 different policies at any one time. So some will be for families, some will be for multi-generations. They're really popular policies right now. And increasingly, we're working with more businesses. So the mental health side of things is massive right now. And that's where we're getting inquiries. So we've got employee assistance, counselling, lots of things included in the policy. And where can we have a conversation about it? So pre and post COVID could be at your place, could be over the phone, over email and Zoom. And if you're a client, then you can use your policy through the app as well. So it's all ready for technical stuff. So right, so straight into it then. Who's ready for a few questions? Yeah, thumbs ups. Won't keep you long on this one, promise, because as Terry said, it's not interesting, but yeah, maybe it is interesting. Let's hope. So a heart condition needing a bypass is really expensive. As at the end of 2019, how much would such a treatment cost? What do we think? And you can shout out or whatever you wish. Got any ideas?
A.
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 Or B. Or C. A lot. A lot.
A lot, yeah, you're absolutely right, yeah. So here we go, it is indeed A. So that's quite a lot of money. So if you think you're paying, it might cost you £1,000 a year, but potentially that could be something that you're claiming for, obviously provided it wasn't a pre-existing condition. So question 2. So a small business, we're talking here, without a dedicated HR department, could your policy could be either a private medical with full cover and stays in hospital, or it could be a cash plan, which is money back on your everyday expenses like optical and dental and therapies and that sort of thing. Can it provide you free legal and HR or manager support? What do we think on this one? So yes, always, yes, but with, or yes, but it's an add-on basically. So you pay for it and then you get the treatment.
C. B. A.
C.
C.
In most cases, with the exception of really large corporates, because they have big pockets, it's always. So there we go. So that's really, really helpful. A little bit like Simon was saying with the platform of letter templates and that kind of thing. That's basically the sort of thing that we can give for HR and manager support, and also processes if you're dealing with redundancies and all that sort of thing. So you may have read that private hospitals made their beds available for the NHS, and that was typically so that heart and cancer treatment could continue. It's not necessarily worked out that way, but that's what was the bulk of it. What's the average wait time for a private consultation? What do we think?
3 days.
3.
Yeah, 3.
Yeah, you're absolutely right. 3 days. I hear from people saying, I've been offered an appointment sooner than I can even get there. So that's really, really good. I mean, at the moment, obviously, there are still some places with restrictions on, might be slightly longer, could be 5 days, could be 7 days. But when things are running as they normally do, then yeah, it's 3 days. So on to mental health. So mental health support, I've mentioned already, it's a major benefit. How many sessions of telephone support could a staff member have, that is, you being the staff member, have with a policy?
6.
It's 6, it's unlimited, within reason, or it's 20.
A.
A.
Unlimited.
Yeah, unlimited. So the within reason basically means that if you were having treatment after treatment and you got to maybe 20 sessions and you still weren't making any progress, then it's a potential that you're going down the wrong avenue. I don't think they would let it get as long as 20 before saying, actually, let's reassess. So, but yeah, you could. If it was deemed necessary and it was deemed to be working, then there isn't a restriction on it, which is really good because some policies do say you've got this cover, but in the small print, only up to X amount. So then, final question, I think, yes. So why is it more beneficial to choose a policy via a partner like me than do it DIY on a price comparison?
Small active speaker video.
What do we think?
A.
All of them.
Was that
All of
Catherine saying all of them?
All of them.
Yeah, absolutely right, all of them. So my job is to obviously not talk to you in insurance jargon, it's to make sure you understand, and also one size doesn't fit all. So it's very much like, let's have a talk, as Terry and as Dan would do.
No.
We do a fact find, we find out exactly what you need, and then we get the right policy for you. And that also means not paying for things that you don't need and you're not going to use. So there we go. Thank you very much for my very quick presentation. Any questions, anybody?
No, that's the problem.
Sometimes I wonder how we get where we get. Everybody
Vaughn, we can hear you.
I'm guessing not. No questions then. Yeah.
Amanda, in terms of the companies that you work with, what sort of size and shape and geographical region do you deal with?
My only restriction is on networking, so I can have clients anywhere. So I've got a few in London, I've got a couple in Glasgow, I've got one in East Anglia, I've got a couple in the Midlands. Obviously the bulk of my clients are in the Northwest. Regarding size of company, it can be any size at all. So if they're a micro business, if they have 2 different addresses for the people who work in the business, they qualify for a company policy. But if not, they can take a personal policy, but the business can pay for it. So it's really flexible, really accessible.